My name is Alex Solis, and I'll be performing cranial nerve testing on my patient here. We're going to start with cranial nerve 1, which is the olfactory nerve. We have a sample of a very strong sample that we're going to be smelling. I'm going to have our patient just cover up one on the left nostril there, and then I'm going to present this, and go ahead and close your eyes. And let me know when you can first smell this sample.
There.
Very good. And cover your other nostril now. And again, let me know when you can first smell it.
There.
Very good. So with that, we could see that we had an equal response from both olfactory nerves on each side. And an abnormal response would be either no detection of the scent or an asymmetry between the two. Now we'll be testing cranial nerve 2, which is the optic nerve. We'll be starting with visual acuity. So I'm going to have my patient cover the left eye. And what's the smallest line you can read out there on the chart?
OHPNTZ.
Very good. Cover your other eye. And what's the smallest line you can read out there?
OHPNTZ.
Very good. So my patient has 2015 acuity, OD and OS, and so we know that his optic nerves are intact there. We're also going to check pupillary responses. So I'm going to have you just look straight ahead, and I'm going to be shining a bright light towards your eyes. And we're first checking the direct response to light here, in the right eye, as well as in the left. And checking a consensual response in both eyes as well. And now swinging flashlight test to check for an apparent pupillary defect. Very good. Pupils are equal and round and reactive to light, and no APD is present. An abnormal response would be either unequal pupils or any lack of the response to light or presence of an APD. And we're also going to check confrontation visual fields. I'll have you cover your left eye here. And look right here at my eye. I'm going to hold up some fingers. Let me know how many fingers you see.
2. 1. 5. 1.
And can you add them together for me?
3. 6.
Very good. And cover this eye. And look right here at this eye.
5. 1. 1. 1.
And add them together for me.
6. 3.
Very good. I'll take that. So his confrontation visual fields were full to all finger counting in all quadrants. An abnormal response would be unable to see those fingers, and I'd have to bring them closer in for him to see them. And we're also going to test color saturation with the red cap test. I'll have the patient first cover your left eye and look at the cap on this bottle here. It's nice and red. If you had to make this redness 100%, just kind of see what that looks like, and then cover your other eye. If you had to grade this redness, how much would it be on a percentage?
100%.
Very good. So that tells us that both optic nerves are equally saturating the color perception, and any difference between the eyes would indicate a problem in one of the optic nerves. And finally, we're going to take a visual look with the direct ophthalmoscope to actually look at the optic nerves and see how they appear. So I'm going to have you look right up there on the ceiling, and I'll be coming close with this light here. Very good. And other eye again, just look up towards the ceiling. Very good. Both optic nerves look round, pink, and distinct, well perfused with distinct margins and normal CD ratios. Any abnormalities that I could see would indicate a problem with the optic nerve, but none were seen at this time. And now we'll be testing the oculomotor nerve, cranial nerve 3, also cranial nerve 4, the trochlear nerve, and cranial nerve 6, the abducens nerve. With that, we'll be doing a physiological H, testing his EOMs to see how those are. So I'm going to have you follow my light with your eyes only. Keep your head still, and let me know if you have any pain or if you ever see 2 lights instead of 1. Any pain on this side?
Nope.
Very good. Pain on this this side?
No.
Very good. So his earlobes are full. Any abnormal findings would be any restrictions seen or any double vision or pain would be cause for concern on cranial nerves 3, 4, or 6. And next we're going to be testing cranial nerve 5, the trigeminal nerve, which is sensation to the 3 areas of the face as well as the cornea. We'll be testing that as well, and also the muscles of mastication. But we'll start with corneal sensation. We have here just a cotton width that we'll be applying to the cornea to look for an appropriate blink reflex. So just look straight ahead there. Very good. We have a nice symmetrical reflex. And on this side. Very good. An abnormal response would be a lack of blink response to the application of the cotton wisp. We're also going to test the sensation to the face. First, the ophthalmic branch. Close your eyes for me. And can you feel that?
Yep. Yep. Yep.
Very good. And here.
Yep. Yep. Yep.
Very good. Any lack of sensation or asymmetry between the sensation on either side of the face would indicate an abnormal finding. And lastly, we're going to be testing the muscles of mastication here. So patient, can you clench your teeth for me? Very good. And I can feel that both of those muscles are producing the same amount of tension on both sides. So that indicates a normal response. Abnormalities would be an asymmetry between the two. Next we'll be testing the facial nerve, cranial nerve 7. We'll be having the patient perform a variety of facial gestures to test the different muscles that are innervated by the facial nerve. So first, I want you to raise your eyebrows. Very good. We can notice symmetry there. And now clench your eyes together. Close your eyes nice and tight. Very good. And now puff out your cheeks for me. Very good. Nice tension symmetrically there. And lastly, bare your teeth. Very good. So we can notice symmetry between all those motions there. Any asymmetry would be an abnormal finding, or any just total lack of control on one side of the face would be abnormal.
Okay.
And now we'll be testing cranial nerve 8, the vestibulocochlear nerve, which is hearing and balance. So I'll be presenting some sound to each side. I want you just to close your eyes again. And can you hear a sound?
Yes.
Which side?
My left side.
Very good. What about now?
Yep. On my right side.
Very good. So if he was unable to detect one of those sides, it would be a damage to the cranial nerve 8, or any asymmetry between the two responses would also indicate an abnormal finding. And now we'll test cranial nerve 9, the glossopharyngeal nerve, which is sensation to the palate. So I'm going to induce a gag reflex with a cotton-tipped applicator here, and it's always a good idea to have a trash can available just in case. So I'm just going to have you open your mouth and... Okay, so a positive gag reflex means that glossopharyngeal nerve is intact, and any lack of a reflex or a lack of response would indicate an abnormal finding. Now we'll be testing cranial nerve 10, the vagus nerve, and I'll be evaluating the uvula. So I'm going to have my patient open your mouth and say ah. Very good. I can see that the uvula was centered on the midline. If there was any deviation present to one side or the other, that would indicate a lesion in cranial nerve 10. The deviation occurs towards the normal side, so I would look towards the opposite side for a lesion. And now we'll test cranial nerve 11, the accessory nerve, which innervates the sternocleidomastoid as well as the trapezius muscle. So first I'm going to have the patient try to turn your head towards my hand here. And I can feel the tension from his neck muscles there. And again, turn towards this hand. Very good. Nice equal tension between those two sides there. And then I'm going to come behind the patient and place some pressure on his shoulders here. Shrug your shoulders for me up. Very good. A nice symmetrical response between both sides of the body there as well. An abnormal finding would be either a lack of any tension in one or just an asymmetry between the two. And lastly, we'll be testing the hypoglossal nerve, cranial nerve 12. So I'm going to have, which innervates the tongue. So I'm going to have the patient just stick out your tongue for me. I'm examining for any atrophy or deviation, and you can relax. So the tongue came centered out on the midline. and there was no atrophy present, which would be an abnormal finding. Also, any deviation to the right or left would also be abnormal. And if there was a lesion, the tongue would deviate towards the side with the lesion.